Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update. Just like last week, we unfortunately don't have time to cover every single bird in care, but we will cover some of our new patients, some of our releases, and some of our interesting birds that have been here for a while. So let's go ahead and get started. I want to kick things off this week by highlighting our most recent release. Here we've got Swainsons Hawk 8-7 flying away back out into the wild in St. Anthony, Idaho. This juvenile initially came in due to emaciation, failure to hunt, and now he's hunting successfully and flying beautifully. Moving right along to our current patients, here we've got one of our smallest birds in care right now. This is female American Kestrel 8-5, and this young juvenile is currently undergoing live prey testing. So basically we're putting in live mice and live crickets into her enclosure to make sure that she can hunt successfully on her own. Since we got her in at an age where her parents would still be feeding her and we will have to return her at an age where her parents will no longer be around to feed her, we have to make sure that she is self-sustaining and that she can hunt on her own. So that's kind of the phase that she's in right now, and as soon as she's able to show us that she can hunt successfully multiple times, she'll be ready to go back to the wild. Next up, we've got Ferruginous Hawk 8-8. And this young bird originally came in from Farson, Wyoming with a pelvic fracture. The fracture is healing up really nicely, and this bird has actually moved out of the PCU and into one of our enclosures in the flight barn. In that enclosure, he's able to be much more mobile. He can get up on some higher perches, and it's a much more natural space for him to begin his flight conditioning journey. Here we have Osprey 8-15, and this juvenile bird actually came from Wilson, Wyoming, so right near the Raptor Center, and he came in due to emaciation. At the time that we rescued this bird, we had just found out news that one of his parents had unfortunately passed away a few days earlier, so we think that the other parent was doing some single parenting and had a lot of mouths to feed, and unfortunately this one took the hit of that and fell on the ground and was really thin, really skinny, not in good nutritional shape. So right now we are hoping to get him to gain weight. We're offering lots of small meals of fish several times a day. And as soon as he gets some more muscle to him, we're hoping to get him back out into the wild to begin his migration come this fall. Next up is Juvenile Swainsons Hawk 8-25. This bird came in from Idaho Falls with some trauma to the right shoulder. Luckily, nothing is broken, but we do have to make sure that he is on cage rest at the moment so that he doesn't tweak it any further. So he is in our ICU in a smaller enclosure where he can't really fly around. And then hopefully in a few weeks we can move him into a bigger enclosure, and by then he'll be feeling a lot better. In the meantime, we've got him on some anti-inflammatory pain medication to keep him comfortable and to help with any swelling. Next up, we've got RedTailed Hawk 8-29. This bird came from Du Bois, Wyoming with some soft tissue damage to his left wing. The injury that we're seeing on his left wing kind of is indicating right now that it could have been an electrocution event. So typically with electrocution events, we see an entry point. In this case, it's where his left wing is. You can see he's got a wrap on his left wing. That's where the soft tissue damage occurred. And then we see an exit point. So the exit point that we were able to locate on this bird is actually on one of his toes, on one of his talons. So you can see we've got it all bandaged up. It's quite a nasty wound on there. So we're hoping that we can revive some of that tissue and see if we can regenerate some of that tissue around the area to get him back out into the wild. Last but not least is Juvenile Swainsons Hawk 8-30, and this bird came in due to a pelvic fracture on the left side of his pelvis. He's currently in our ICU on supplemental oxygen and several different pain medications to help keep him comfortable, and then hopefully once things start to begin healing, he can move out of that ICU unit and into a smaller enclosure with ground perches so that he can't fly up high and further injure his pelvis during the healing process. All right, that's all we've got for this week. I hope you guys enjoyed learning more about our birds, and I look forward to talking with you all next week. Remember that you can do your part to help keep wild birds wild by going to our website at tetonraptorcenter.org and making a donation. Bye!